start.
Okay, ma'am.
Good afternoon, everyone. A warm welcome to Back to School Season 3, Episode 4. We at Mahadevi Birla World Academy are working towards preparing our students to be creative, innovative, agile, and curious. The faculties they need in the 21st century. The Back to School sessions are a way to open the world of opportunities, ideas, and options for our students. These sessions help to improve communication, prepares one to anticipate and face challenges, encourages creative and critical thinking. It further boosts continuous development and improvement of the various abilities that our students need to contribute positively to the society and be responsible citizens of the ever-changing, unpredictable world. This is also a scope for them to build their network and learn from each other to get ready for life beyond school. We are privileged to have with us today Dr. AASTHA TODI, who is going to share her valuable insights and experiences in the field of oral hygiene. I would also like to take this opportunity to extend a warm welcome to Ma'am S. Ghosh and her students from Birla Divya Jyoti, Siliguri. Thank you for joining us today as we look forward to an enriching session with Dr. Todi. I would now like to invite Tamanna Ghosh to please introduce our guest today.
Dr. AASTHA TODI has completed her BDS from the prestigious Manipal College of Dental Sciences, Mangalore. She is currently pursuing MDS in periodontics and implantology from GNI-DSR. She has sheer interest in the field of dentistry and wants to master the science of implantology and TMJ disorders. She has also received an All India Gold Medal in the field of public health dentistry. We are elated to have you amongst us, ma'am. I would now like to request Dr. Todi to please address the gathering.
Thank you so much, Polomi and Tamanna, for the warm welcome. Good afternoon, my respected teachers and my dear students. At the onset, I would like to thank Principal Ma'am, Mrs. Anjana Shah, for giving me this opportunity to reconnect with my alma mater. Mrs. Suparna Roy Ma'am, for constantly keeping me abreast with the procedures of this program, and especially to all your dear students who are present today in this winter afternoon to attend this webinar, and all other teaching and non-teaching staff who are presently trying to run this program very smoothly. I am Dr. AASTHA TODI and I am a dentist by profession. I have always envisioned myself in my school days to be a doctor. During the same time at which I got my teeth aligned with braces from a dentist, and my focus completely shifted after seeing the confident smile that he gave me at the end of my treatment. And I thought, what better profession to be able to be a doctor as well as spread smiles across. Hence explains my dental profession. I would like to start my presentation by a small quote, "Life is a camera, so keep smiling." Since the day I stepped foot in the premises of my school, Mahadevi Birla Girls Higher Secondary School, now Mahadevi Birla World Academy, I have always been enthralled by the massiveness in terms of its infrastructure and warmth from everyone I met on my journey. I have always loved going to school, and it was never a burden for me. I had always looked forward to going to school and never made excuses to bunk school. And from the beginning, our school's motto is something that is deep-seated in my heart, Tamso Ma Jyotir Gamaya, which means, "Oh Lord, please lead us from darkness of ignorance to the light of knowledge." I strongly believe that an education and knowledge can only make this world advance and free from the web of fallacies that exists. Coming to the best 14 years of my life, I have been fondly remembering the 14 years of my school life since the day I was told that I can conduct this webinar. The years from 1998 to 2012 have been nothing but a blessing for me. I strongly believe that my school has been the foundation that has shaped me into the human being that I am today, and has also paved way and shaped me into the human being that I am, and paved way to the foundation of my career. I owe a huge part of my success to this institution, its teaching and non-teaching staff. As I moved up my classes each time, I learned new things. In the junior section, I learned the importance of good friendship, the values of having a good person in your life who would teach you the correct values. In the middle section, I was taught the meaning of what teachers hold the position in your life, the values that they imbibe in us, and the good knowledge that they impart in us, and all the good activities and hobbies that they have instilled in me, which I still so far follow. In the senior section, I learned the importance of education, which formed the background to what my career would be. It was a very important part of my journey as I had to make the decision of taking the science stream and follow my dreams. And not to forget Krira Kunj, because I have been a voracious student in terms of sports activities, and I still love playing a lot of sports. So thank you to this wonderful institution. Next, coming to my small journey, after completing my class 12 in the year 2012, I had to drop a year, and in the coming year 2013, I appeared for the NEET UG medical exam as well as the Manipal entrance examination, which I cleared, and hence I started my BDS in the year 2013 at the prestigious college of Manipal College of Dental Sciences, Mangalore, which was a 4-year course along with 1 year of compulsory internship, which I completed in the year of 2019. Simultaneously, I was preparing for my NEET PG post-graduation and MDS entrance exams, which I gave in the year 2018, and I cleared it in the year of 2019. And I'm currently pursuing in my final year of Master of Dental Surgery in Department of Periodontics and Implantology at the Guru Nanak Institute of Dental Sciences and Research, Kolkata. Okay, so coming to the introduction, as we all know that this pandemic has hit us for the past 2 years and it has been extremely difficult. I hope that in this phase of pandemic, you're all safe and taking good care of your health as well as everyone in your family. The last 2 years have been extremely difficult for one and all, and I hope that you have been prioritizing your health, which is most important, as in this era, it is the survival of the fittest. As we all know that you have all been attending online classes in the past 2 years, it's very difficult to not be able to go to school and mix with your friends, do all the masti and fun that we used to do. So hence we have to attend this online sessions that definitely do enrich us, but going to school and learning something is quite different. So this brings me to the topic of my presentation today, oral health and hygiene. Introduction. So the first tooth that erupts in the mouth or the oral cavity is at the age of 6 months. Before that, I would like to introduce the parts of a tooth. As we all know that before 6 years of age, we all have primary teeth or the milk teeth, which are 20 in number, and they usually erupt by the age of 4 years, and they completely exfoliate from the oral cavity by the end of 6 years, after which the permanent tooth comes into the oral cavity, which are 32 in number. So these tooth have a basic structure of a crown and a root. The crown portion is the one that we can see in the oral cavity, the white portion, and the root is one which is embedded inside the gums, inside the bone socket. The tooth has a structure of an enamel, dentine, and the pulp. The enamel is the most protective and the hardest substance of the tooth. The dentine is the one which protects the inner pulp, which contains all the vascular and the nerve supply. It contains all the vital organs that is present inside the tooth, which keeps it alive. The period between 6 to 13 years is a period of mixed dentition where both primary and permanent teeth are present, and the permanent tooth in almost all the people erupt at the age of 21 years. What do you mean by oral health? Coming first to the term health. What do we mean by health? Health is nothing but the state of physical, mental, and social well-being. So when we talk about oral health, we just not talk about the teeth and the gums, that is the dental health. We talk about the jaws, the chewing muscles, the roof of your mouth, the linings of the mouth, the tongue, the lips, the salivary glands, the various mouth and the facial pains, and the oral or the throat cancers. There may be various causes that can lead to toothache or a lot of unease that we feel in the oral cavity. Some of which may be sensitivity in the tooth when we consume anything hot or cold, and we have a tingling sensation, and that's when we know that there is some problem in our tooth. It may be gum problems where we have this nagging sensation that if we press a certain amount of we put a certain amount of pressure on our gums, there is a relieving pain. So that is an indication of a gum disease. It may be an impacted tooth. Usually the wisdom tooth, that is the last tooth, is supposed to be, not erupted in the oral cavity, and it poses a problem after 21 years of age. So that's when it causes a pain at the back of the tooth, and subsequently the tooth that is present before also leads to a lot of problems and complications. Inflammation of the tooth pulp may occur if there is a tooth decay that has extended into the deeper layers of the tooth, which leads to pulpitis. That is nothing but the inflammation of the tooth. So when we have anything sweet, or there is a pain when we are climbing up the stairs or lying down, we can easily say that it is pulpitis or inflammation of the tooth pulp, and it needs immediate action. There may be some of us may have a tendency of having sinus problems, due to which there is a huge common tendency to have dental problems and pain. A tooth infection may also lead to an abscess if it is not treated at the right time, or any trauma happened to the tooth. Suppose we bite onto a hard object, it may lead to a fracture on the tooth or a cracked tooth, which will lead to common dental pain. To deal with the various problems that I just mentioned, the various super specialties in the field of dentistry are, I would like to keep my department at the top: periodontology and implant dentistry, orthodontics and dentofacial orthopedics, oral and maxillofacial surgery, conservative and endodontic dentistry, pediatric and preventive dentistry, which usually deals with the kids. Conservative and endodontic dentistry usually deals with the fillings and the root canal treatments, as I mentioned in the pulpitis case. Oral and maxillofacial surgery leads with extraction, impacted tooth, any soft tissue surgeries, or any cancer patient. Orthodontics and dentofacial orthopedics deal with the teeth which are not aligned properly, or any facial profile discrepancies. Prosthodontics and prosthetic dentistry deals with missing of the rehabilitation of the missing teeth. Oral pathology leads to any problems related to the oral cavity, where you have a burning mouth syndrome, or you have a erythematous gums, or any pathology that is difficult to detect, or as simple cases such as mouth ulcers. And public health dentistry is the community dentistry part in the dental facility. All of these have one common goal: to provide good smiles and spread smiles among all the patients and all the people. So what is the root cause of dental infection which leads to pain? As we all live in a microbial world which is full of microorganisms, it may be in the industry or the environment, there are a lot of pipelines or a lot of spaces where there is water flow. Any flow of water or any flow of system where microorganisms can attach and survive leads to the formation of something that is called a biofilm. The root cause of any dental infections is the formation of a biofilm. It may be present in the water lines, it may be present in catheters, it may be present inside the oral cavity, it may be present inside your bodies. Anything can lead to the accumulation of the biofilm. This biofilm is nothing but a layer of fluid that is attached to the surface of your tooth due to the presence of bacteria as well as your saliva. So when these form a complex, it leads to the formation of biofilm, which is nothing but the accumulation of bacteria on solid surfaces, and it is not a dental phenomenon. It occurs in all surfaces that consists of a natural aqueous environment. And in the oral cavity, the dental biofilm is known as plaque. So as we can see here, if there's a presence of a healthy tooth and if the plaque is allowed to accumulate, for example, if you have brushed our teeth in the morning, in the next few seconds, we will see the formation of a plaque due to the presence of innate microorganisms that is present in our oral cavity and the saliva, which forms the plaque formation, the fluid surface that is present. So once this biofilm is formed on our teeth, the bacteria gets a surface to attach upon. On this plaque surface, when sugars or any food items interact with the bacteria, it releases acids, which further causes the release of further ions from the tooth surface, causing demineralization of the tooth. This demineralization of the tooth leads to tooth caries and cavity. A similar kind of disease is formed when the gums are infected due to the presence of plaque. So plaque is nothing but a thin layer on the tooth surface, as I have already mentioned. So it is not visible to the oral cavity. We usually use disclosing agents in our dental practice to visualize the plaque. So if you can try to feel it, it is just a fuzziness on the tooth surface. It will provide you with a bad odor or a bad smell from your mouth. And if it is, it is sustained for a longer period of time, it leads to gum redness and tenderness. And occasionally when you're brushing your teeth, it may lead to bleeding from your gums. So this is how a healthy gingiva looks like. Gingiva is the scientific term for gums that we use in our dental fraternity. So this is a case of healthy gingiva, and when the bacteria is allowed to accumulate on the tooth surface, it leads to inflammation and breakdown of the various structures that protects the surface of the gums and the tooth. So it leads to gum diseases and bone destruction, which will eventually lead to tooth loss and mobility. That is, the teeth will start moving eventually, and the movement of the tooth along with the destruction of the bone and the gums is nothing but periodontal disease, that is the gum disease. Periodontal term has come from the word periodontium, which is nothing but the supporting structures of the tooth, that is the gum, the periodontal ligament that attaches the tooth to the bone, and the bone itself. So next, we should know the importance of oral health, because oral health has a significant implication on the systemic health of a patient. The mouth is nothing but a gateway that takes care of the oral as well as the systemic health. If we allow a lot of unwanted bacteria to accumulate in our mouth, it will lead to a lot of systemic complications such as diabetes and insulin resistance. So I, in my dental practice, have come across so many patients who come to me with a dental problem. And once I see the clinical features, I have advised them to go for a diabetes mellitus checkup. And they have reverted back to me saying that, ma'am, I did not know that I had diabetes, but since you had told me to get it tested, now I know that I have diabetes. So periodontitis, as it is my field, I can say that periodontitis is the 6th most common complication that we can see in diabetes patients, and vice versa. A patient having diabetes has a huge chance of getting periodontal infections. So all you students, or in fact all the faculty members, the teachers that are present here, I would highly recommend you that if you have diabetes, you should be a little extra careful to maintain your oral hygiene, because we don't realize how the bacteria spreads in our body. But once the infection starts in your mouth, the complication inside the body becomes very difficult to manage. Not just diabetes, there are a lot of cardiovascular diseases that happens due to oral infections. A lot of gastrointestinal diseases can be seen due to an unhealthy mouth. A lot of respiratory tract infection and bacterial pneumonia is supposed to be seen. And there is evidence of literature that has proven that unhealthy mouth can lead to such systemic problems. In fact, a lot of pregnant women have come with a complaint of swollen gingiva. This happens due to the hormonal changes. And I'm sure that, they will never think that, oh, due to my hormonal problems, I have a dental problem as well. So now that you are aware about it, if there is someone in your family going through this, please advise them to go for a regular dental checkup during their phase of pregnancy. And now during the COVID times, I would like to specifically mention that anyone in your family, if they have been recently infected or it, has happened in the future, please advise them to go for a change of their toothbrush, because the amount of oral bacteria that is present remains in your toothbrush. So once you have come out of that phase, the bacteria remains in your brush, but you don't realize that you're brushing from the same amount of germs that is present on the toothbrush. So immediately it is advisable to go for a change of your toothbrushes. So I cannot emphasize on the importance of the removal of plaque that we have been talking about so far. It is very important to remove the plaque that is the root cause of all the dental problems. It is recommended to brush twice daily to remove the bacterial load that is present due to the copious amount of saliva that is present in the oral cavity. So there may be two methods that we can remove the plaque with. It may be a mechanical method where we are physically, manually removing the plaque that is present with the help of toothbrushes, flossing, tongue cleaning, etc. And it may be due to with the help of a chemical agent, that is mouthwashes, various types of antibiotics. So this is basically the dental team of plaque controlling, manual plaque controlling methods that I can, advise you to use on a daily basis. As we can see here, there is a toothbrush, there is a toothpaste, there is a flossing agent, and there is a mouthbrush, along with the importance of tongue cleaning. So I will not recommend you to go for any particular brand, because it is against my profession. But yes, brushing twice daily is very helpful, because in the morning, when we start our day, it is very important to have a fresh mouth with a good freshness and energy, positivity, where there is no foul smell, there is no presence of plaque, and there is no presence of bacteria in your mouth. So when we are brushing in the morning, the remaining of the night that we haven't, chewed anything or not eaten anything, there's a huge amount of saliva that remains in our mouth in a particular place. So you can imagine, as I said, once you brush your mouth, the plaque comes in within few seconds. So the last that we brush at night is around 10 o'clock or 11 o'clock, just before we hit the bed. From 11 o'clock till the next morning, about 7-8 hours, the oral cavity just remains filled with plaque. So it is very important to wake up in the morning, and the first thing you should do is to remove the amount of plaque that is present on all your tooth surfaces. And along with that, the importance of tongue cleaning is that tongue harbors the maximum amount of bacteria on its surface, because we usually neglect cleaning the tongue, and we think that, okay, it does not, there is no place where the food can accumulate on the tongue, but the tongue contains a lot of papillas into which the bacteria that is so small in size can accumulate with it. So it is very important to clean the tongue also, along with cleaning your all the tooth surfaces. Here's a small video that I would like to show. This is the ideal method of brushing that we all should follow. I know it is difficult to manage with the angulation and the placement of the toothbrush onto the tooth and the gum surface that it is shown, but I would recommend you to watch this video as number of times as you can on the social media platforms or YouTube, and please try to follow this, because this is ideally the only way to keep your mouth and the teeth surface clean. So here you can see. So yes, that was the video. I know keeping an angulation of 45 degrees is very difficult, but yeah, as you can see, placing the tooth partially on the teeth, partially on the gums is very important because it helps to clean the junction between the tooth and the gums where the maximum amount of plaque and bacteria can accumulate. As well as, I would like to emphasize that you should always try and use a circular motion rather than a horizontal motion because it leads to a lot of abrasion on the tooth surface. And as you had seen that it involves the cleaning of 2 to 3 surfaces of the tooth, 2 to 3 teeth at a time. So always utilize 2 minutes to clean all the tooth when you are trying to brush. As I'm going to mention, it is recommended that teeth should be brushed twice per day with a toothpaste and cleaned using interdental aids. The aim in the end is to prevent plaque and to eliminate already existing clinical signs of gum inflammation. The brush usually loses its shape and capacity to remove the plaque due to the amount of force that we use while brushing. So ideally, it is advised to replace your tooth after every 3 to 4 months. A patient can analyze a worn toothbrush with a splayed or a frayed filaments. When you see the bristles of your tooth, it will start. You can see that it has started fraying. So I think that would be the correct time for you to replace your toothbrush as it loses its resiliency. It is important to determine that plaque removal and brushing should be done for ideally 2 minutes or longer, as each tooth at least takes 10 to 15 seconds to remove the amount of plaque. So 2 minutes is ideally encouraged regardless of the brush that you use. Brushing last thing before going to bed and in the morning with a pea-sized amount of fluoride toothpaste helps remove the plaque and bacteria. So I would like to emphasize here on the term pea-sized because toothpaste usually contains a lot of abrasives. So we don't want to use a lot of toothpaste to provide us with a fresh breath, or if we use a lot of force or a lot of toothpaste, the plaque will go away quickly. No, this is not the sign. Ideally, a pea-sized amount of toothpaste is enough. A normal hand pressure is also enough. It will lead to the same amount of plaque removal that you would do if you apply too much of force. And also the term fluoride toothpaste, because as I mentioned that there is demineralization of the tooth surface due to the acid. This fluoride helps in the remineralization. A tooth is basically formed by the calcium and the phosphate. So once the calcium is gone off due to the demineralization, those areas are replaced by the fluoride content of the toothpaste, and it helps to remineralize the tooth structures that we have lost. The mineral in the tooth structure, basically. So here is another video that I would like to show you to clean the area specifically between two tooth surface, which is slightly difficult with the use of a normal toothbrush. So this is ideally the way we brush with the help of a toothbrush. Only the buccal surfaces, that is the surface towards the lips, are cleaned. But the space between the two teeth can be cleaned only with the help of a floss, as you just saw in the video. So along with the brush, a floss is ideally required to clean the interdental areas. Okay, so many patients are usually unable In fact, many normal people are unable to manually clean their brush because of various age-related factors such as old age people or maybe children or some patients who are mentally disturbed, or there are some of them who have joint problems, so they cannot put in the manual force that is required. Hence, for these patients, power toothbrushes have been introduced in the market, which will provide the necessary vibrations required to remove the plaque. You just have to place the tooth on the surface, place the brush on the tooth surface, and it will do its job. This is another very good invention in the field of dentistry. This is a water pick that is used between the two teeth to remove and eliminate the bacterial colonies that are formed. So let's take a quick look at the video, which basically shows us the position. So yeah, here we can see that there was no use of any toothbrush. So for you might have a question in your mind saying that why use paste always? Water can do its job as well, but the abrasiveness that is present in the toothpaste is not available in water. So as we saw in the video, the water itself removes the bacteria in between the tooth as well as on the tooth surfaces. So there are a lot of dental flosses that are available in the market for easy use. So usually there is a spool that can be tied around the hands and the flossing can be done. I will just show you the video for that. Or a handled floss is used these days for easy use. So we just use the handle, place it between the tooth and the tooth surface between two teeth. That is the interdental area can be easily cleaned. So there are two types of flosses, a waxed one and an unwaxed surface, which is basically due to the taste and the flavors that some of us don't usually like. Interdental brushes are another aid which is used to remove the bacteria or the food debris that is present in between the tooth. Here, I would like to please request you all students that if anyone in your family, if you see anyone in your family using a toothpick to remove any food debris that is stuck inside their mouth, please be firm and ask them not to do it, because it is very harmful to the gums and it leads to more gaps in between the tooth, which just aggravates the problem. The food will not just accumulate there more, it will also lead to receding of the gums. So always ideally use an interdental brush which is placed between the embrasure space. Embrasure space is nothing but the space between the tooth where the gingiva rests, where the gum rests. So according to the embrasure size, there is a narrow interdental brush and a wider interdental brush. So, they can easily analyze the space that is present and it is readily available in all medicine shops. Similar to a toothpick, interdental wood picks have been, invented, which are not sharp like a toothpick. It has a triangular wedge-shaped structure which can be easily inserted in between the tooth to clean the tooth surface. This is the proper flossing technique. I'm sure you all can see these videos on YouTube as well, but I have specifically mentioned these particular videos so that you know that these are very important in day-to-day practice, and following the correct method will only help you to remove the plaque. Because if you do it in an incorrect manner, you are not just letting the plaque accumulate, but you're also cheating yourself that you have tried cleaning, but it is not the results are not coming. So please try and follow these correct techniques so that it helps you in the future to maintain your oral health. So having a balanced and a healthy diet is very important to have a healthy teeth. So a healthy diet involves not just avoiding snacks in between, which is high in carbohydrates or sticky sweet snacks, And it also involves eating a lot of vitamin-rich foods, such as papaya, which is rich in vitamin A, or carrots. Vitamin C helps in a lot of way to to keep your gums healthy, as well as in this current corona situation, we have been having multiple vitamin C's, and honestly, it helps to keep the gingiva healthy, the gums healthy. Vitamin D in the form of eggs, fish, cod oil, cod liver oil, all these things helps to keep the tooth strong, because the calcium content is very important in the tooth. I've already mentioned the importance of fluoride in the oral cavity. So all these food items which are rich in vitamins really help you to keep your teeth healthy, because what we eat is how our body responds to. So kindly avoid having a lot of sodas, alcohol, because some amount of phosphorus is good for health, but excess of it will lead to will have a detrimental effect on your tooth. So yes, so the bacteria also likes unhealthy food like we do, because it is tasty. So as we have a lot of unhealthy food, the bacteria also likes it, and it, as soon as you have healthy food, it also gets to eat a lot of unhealthy food that is stuck between our mouth, and it leads to some simultaneous acid release, demineralization, etc., and hence dental problems. So yeah, let's all try to stick to healthy food. So when we are not able to maintain our oral hygiene at home, it is time that you come for professional cleaning. So what is professional cleaning? It is scaling and root planing. So in scaling, we use ultrasonic machines to remove the plaque and the bacteria, and as well as the calculus that is formed on the oral cavity. So calculus is nothing but the plaque which is accumulated with a lot of bacteria and food substances, and it forms a thick stony layer of tartar, and it is hard in surface, so you cannot remove it with the help of a brush. That is when you have to come to a professional and get your teeth cleaned. So we recommend you that you should get a cleaning of every 6 months, so that your gums and the teeth remain healthy. Root planing is nothing but subgingival. That is, we go beneath the gums, inside the gums, and clean your tooth surface and remove any amount of necrotic or damaged tissues that is present within your gums, to keep it clean and healthy. As you can see in the picture, this is a before scaling picture, and after we are scaling, that is oral prophylaxis that we call. The gums become very healthy, and the red edematous clinical appearance also goes away. So I would like to quickly tell you the benefits of teeth scaling. You get to enjoy a brighter and a shinier teeth, of course. It leads to a better gum health. It gives you a very fresh breath. It protects your general health also, because a lot of bacteria is removed away, so there is no chance of systemic diseases. It prevents from further disease progression, and it gives you a much better and a confident smile. So we have a lot of patients coming to us that Amar smile, Amar daant tonic, nongra ache, and all that. So yes, they are just wanting to get a better smile and a shinier teeth, but they don't realize that what they are also doing is they are maintaining their oral health. There are a lot of myths and fake facts about scaling, that it is painful, it leads to more sensitivity in the tooth, it may lead to more tooth movement, or it may lead to more of gingival recession, that's the gums recede or make it loose, or the gaps increase. These are all myths. The only benefit, the only thing that may happen is, yes, once you remove the calculus, the tooth may move, because that is when that is the time where your tooth is only standing due to the presence of that stones that are present in your oral cavity, and it is just adding to the burden of bacterial load. These are the various periodontal treatments that occur in my department. The gums are black in color. We can remove it with the help of a depigmentation surgery. When the gums are receded, we go for a gingival recession coverage, where we can bring back the normal contour of the tooth. Then a lot of people in your house may be hypertensive, and they may be taking a lot of hypertensive drugs, which may lead to a gingival enlargement. The gums become enlarged, it bleeds a lot. So we go for a drug substitution. Please advise them to come to us. We will tell them to go for to go to a physician for a drug substitution, and subsequently we will remove the bacterial load and help them maintain their oral hygiene. Another very important aspect is the rehabilitation of the missing teeth, that is implantology. That is also that I deal with. So the consequences that happens once the teeth are missing, and the rehabilitation options are, once the tooth is lost, there may be migration of the teeth that is present beside it, or the opposing tooth that is present. You eventually start just chewing from one side. There may be bone loss that is happening where the tooth has been missing, because the bone is what holds the tooth, right? So if the tooth is not there, the bone has no function, so it will start resorbing in itself. There may be a lot of biting issues, because one side you have the tooth, the other side you don't have the tooth. There may be loss of contact, because adjacent teeth are missing. So then the amount of contacts that we required is all lost, and there may be food lodgement due to it. A lot of joint problems may occur. So the solution to all of this may be a removable denture that you can remove and put it back, and fixed prosthesis. Fixed prosthesis involves two options, that is a crown and bridge that I'm sure you must have heard, that involves cutting down of your adjacent tooth and placing a bridge over it. And the ideal option is the placement of implants, or the screw, the titanium screws that we place in the area of the missing tooth that acts as the root portion of the tooth, and on top of it we place the crown. Okay, coming to the last part of my seminar, there are a lot of advances that has come into the picture in the field of dentistry in the form of microsurgeries, which help us to give a different scenario in the field of dentistry, where we use minimal equipments and instruments and give brilliant results. Laser, which helps us to give minimum incisions and minimum trauma to the patient. CBCT is a huge 3D technology that we use in the radiographs to give us a good picture of the hard tissue structures in the tooth. Stem cells and mapping help us, gene mapping help us to figure out the gene sequencing, which helps us to realize the genetic mutations that happen and causes the disease in the various patients, which may present as an etiologic factor. Piezosurgery and ultrasonic technology. All these have helped us to, create as minimum trauma to the patients as we can and give them beautiful smiles and results. So very quick tips before I end my seminar. Warning signs are no smoking, poor brushing habits, frequently snacking on sugary food, drinks and foods and drinks. As ma'am just said that during lockdown we eat a lot of food and don't rinse my mouth. So big no. Diabetes patient, a little careful. The use of medications that reduce the amount of saliva, family history or genetics, certain infections such as HIV, AIDS, hormonal changes in the woman, as I just mentioned, and people with acidity have a frequent tendency of vomiting. They have a lot of erosions in the teeth. So yeah, these are the warning signs. You should always be careful to look after your tooth if you have any of this. So keeping the safety factors, don't go to the bed without brushing your teeth. Always brush properly with the correct technique. Don't neglect your tongue. Tongue cleaning is a must. Fluoridated toothpaste is a must. Flossing at least 3-4 times in a week is a must. Don't stop flossing because it's a difficult thing. Keep trying. Practice makes you perfect. Consider using mouthwashes twice daily for 2 weeks in a month. Stop it for 2 months, again continue. Drink as much of water as you can. Eat fiber-rich food and limit sugary and acidic foods. Okay, so as a dental profession, I can tell you it is I love what I do. So once you do a bachelor's degree, you have a lot of options. You have a lot of competitive exams that you can appear and go abroad. In India, you can further pursue a master's degree, do a MBA and go for hospital management, start your own business as an entrepreneur, do consultations, get into the field of academics, be a teacher, teach and make other students like us become better doctors, good doctors, you can go into the field of research, or you can set up your own dental clinic. The last part of my presentation is an ode to my school and my teachers. Just a few lines. I stepped in the school as a naive little girl and left teary-eyed as a confident individual, and all that happened in between was a weave of magic and memories. As for my teachers, they are my heroes. That is both obvious and true. We cannot take it for granted and allow it to let us lose sight of how much teachers matter, how important their role in education and making our world a better place is. So I uh, thank this institution and all my teachers for giving me this opportunity today and making me what I am. Please always ask questions. Identify all the problems that you had. I am sure that you must have jotted down a lot of questions that were brainstorming in your mind during the presentation, and I would love to answer them all to the best of my abilities. Thank you.
Thank you so much for that extremely informative and interesting presentation. I think many of us are wondering whether we brush our teeth properly and do it at the proper angle. I am wondering. So we will open the floor to questions now. Please raise your hands if you have questions, and we'll take it one by one. I'll call out your names, and you can ask your question. Okay, so please raise hands. All right. So the first question, let's have Ishani Datta. Ishani, you can ask your question.
Yes, ma'am. Good afternoon, ma'am. So my question is, how should we prepare our study schedule so that we are able to score better marks in the field?
Okay, so thank you so much, Ishani, for bringing this up. I'm glad you did that. It is very important to restrict yourself to a time frame and stick to timelines, because if you feel that you are not able to cope up, take a break. Give yourself time, do what you love, do what makes you happy, and get back to achieving your goals. The ideal aim should be you should understand what you are studying and not mug up. So that is the only way to achieve good marks.
Thank you.
All right. Can we have Dia Bhattacharya to please ask the next question? Dia?
Good evening, ma'am. Ma'am, there are some people who help around in my house who have a lot of oral hygiene issues. So could you suggest something so that I can help them with that?
Sure. Honestly, presently, I have the same issue at my house right now, and my parents really scold me that being a dental profession, you are not able to help them. But it is such a situation that I cannot take them to where I go to study because it is too far off, and they are not able to afford the private practices that we go to. So the in-between solution is only that you probably they may have sensitivity or pain, so you can always go and suggest, you can always give them a sensitive paste. Okay, so that brings me to the usage of a sensitivity paste that we all, I'm sure, would be using in case we have sensitivity. It is always ideal to put the paste on your teeth and the gums for a minimum time period of 15 to 20 minutes. Let it stay in your mouth for this particular time period, because the chemical activity in the dentifrice or the toothpaste requires 15 to 20 minutes to act on the tubules, which causes the sensitivity. So that will, I'm sure, help them. And I can always suggest you the painkillers. Other than that, the only way is if there is a health camp or a dental checkup camp near you, you can probably take them there. Or I should start setting up public health camps so that you can bring them there. That would be a good option.
Thank you, ma'am.
Okay. Next, Manav Sharma. Manav, please ask your question.
Good evening, ma'am. Ma'am, I would like to ask that, ma'am, excessive cleaning lead to damaging enamel. Ma'am, does it make the surface of the teeth rough?
Okay, thank you for asking this, Manav. Yes, I have heard this from a lot of people that if you brush a lot of times, it may erode the enamel, but no, enamel is supposed to be more hard than diamond. So just the use of dentifrices will not erode it. But yeah, if you continuously brush in a day more than 5, 6 times with a lot of forces, anything will get demineralized. It will not get eroded, but it may get demineralized. So ideally, anything that you eat in between meals or during meals, or if you're traveling anywhere, keep a bottle of water. Don't let the food debris be inside your oral cavity. Rinse. Rinsing is a better solution than continuously brushing.
Thank you, ma'am.
Okay. Aratrika Basu, please ask your question.
My question is, how does poor oral hygiene affect someone's life, even though they are good in every other aspect?
Okay, thank you, Aratrika, for bringing this question up. It is actually quite interesting if you've mentioned that person is a jack of many trades to be not able to maintain his or her oral hygiene. I am sure he can spare that much amount of time to do that because it is very important. Because currently, as we are all using masks, I am sure that nobody is very cautious of the fact that they might have a lot of food debris or a foul smell in their mouth. But as I mentioned in my presentation, a lot of things are happening inside your oral cavity, which also affects your health, systemic health. And we don't know, it goes, unnoticed. So it also makes the person confident as an individual if he or she is able to maintain his or her oral hygiene, because that way the appearance, the smile, everything becomes very confident, and it looks very pleasing as well. So I would highly recommend to maintain your oral hygiene and health so that you are more confident as an individual.
Thank you, ma'am.
All right. Next, Suhani Pugalia.
Good afternoon, ma'am. Ma'am, can everybody use the same kind of brush, or should the structure of the brush depend on the age or the gender of the person?
Thank you, Suhani. Again, a very frequently asked question to me. So yes, as we say that clothes are an individual fit, so are the toothbrushes. So ideally, if we cannot recommend a particular toothbrush for anybody, it depends on the age of the patient and the current oral health status of a patient. So if you have a gums which are diseased, you cannot use a hard toothbrush. You have to go for a ultra soft or a soft toothbrush with minimal forces, or you might have to go for mouth washes and additional supplements to help maintain your gum diseases. So no, you cannot prescribe a particular toothbrush to a particular person. It has to be individual preferences.
Thank you, ma'am.
Okay. Oyantika Das, please ask the next question.
Yes, ma'am. Ma'am, I have two questions. One is, what is dental insurance and how popular is it in our country? Also, how can ordinary people benefit from it?
Okay, I was really hoping that someone would bring this up. So thank you so much, Ayantika. In a developing country like ours, it is surprising that apart from major surgeries of the body, there is no other insurance. Specifically, a dental insurance does not exist. I strongly feel that there should be some provision made so that people are more knowledged about the dental problems and avail more for its treatments. So so I would actually tell you right now is that your maintaining your oral hygiene is the only dental insurance that you have.
Okay, thank you, ma'am.
Okay. Zara Afroz.
My question is, since you are a busy dentist, how do you get time to continue with your hobby?
Thank you so much, Zara. As I mentioned, I am a very sports loving person. So I make sure to take out some time in my evenings to go play some badminton, play some basketball, which is a huge distraction and a huge happiness factor for me, because any profession that you are into requires a lot of hard work and dedication. And we are all busy, and it's a good thing because it's a blessing that we get to do what we want to do. But yes, you should not let go of your hobbies, because that is also helpful to bring out your other talents that you possess, and you should always follow those hobbies. So I have made sure that I give myself some time to reading books every day before I go to sleep, and it I have inculcated in my day to day habit to do all those things that makes me happy apart from the profession that I follow.
Thank you.
Okay. Ritama Sarkar, would you like to ask your question, please?
Yes, ma'am. So, ma'am, I have two questions. So, the first one is, how do you think we can spread awareness about oral hygiene and health among the underprivileged? And the second is, how can we ensure that they have the access to the required resources that enable them to keep a good oral health?
Okay. Thank you, Ritima. I believe somebody just asked about their house help having the same problem. It is the same thing. They are all underprivileged and they are not aware of what dental issues are or how they can rectify it. For them, the only solution is if they have the tooth pain, can I get it extracted? So no, that is not the solution, because if we have a finger infection or a nail infection, we don't tell them to get it surgically removed. We should always try and explain it to them that having a natural tooth in the oral cavity is very important for them to understand that we cannot remove the tooth. And yes, for helping them out, I think we as dental professionals should hold a lot of public health camps and dental checkups, so that these people are able to come to us and we explain it to them. So once you get into the field of dental practice, which I'm sure you should, and I would love to have you, you should plan and organize more of dental health camp checkups. And in those camps only, we provide them with field samples. So I would like to, since you have raised this point, I would like to give you a small example of what happened recently at a dental camp that I visited from my college. So this happened during the COVID era. We were distributing a few mouthwash samples to them, and they accidentally happened to think that those are hand sanitizers. So yeah, they were all very eagerly raising their hands and wanting to take those mouthwashes, not realizing that it is a mouthwash. So they are not that well educated to be able to know the use of mouthwashes, and it is only through our camps and regular checkups that we can educate them.
Thank you, ma'am.
Tamanna Ghosh?
Yes. Dr. Todi, I also had two questions to ask. So, firstly, why are we only advised to brush twice or thrice a day, not more or not less? And secondly, how does not cleaning of the tongue contribute to bad breath?
Uh, Thank you so much, Tamanna. I think I have already covered a lot of it during my presentation. I have repeatedly told that you can always go for brushing more than 2 times in a day. But yes, it leads to a lot of erosion of the tooth because of the abrasiveness of the toothpaste. So instead of brushing, I would always recommend you to go for water rinsing. That is ideally the best way to remove the food debris if you have eaten in between meals. And the importance of tongue cleaning, as you have mentioned, tongue harbors a lot of bacteria because of the papillae that it contains. So ideally, once in a day, tongue cleaning is very important so that you remove the layer of bacteria that forms on the tongue. And also, we don't realize, but most of our bad smell in the oral cavity is due to the layer of bacteria that is formed on the tongue. So tongue cleaning is very important.
Thank you, ma'am.
Okay, Swayam Agarwal, would you like to ask the next question, please, Swayam?
Thank you, ma'am. So my question is, ma'am, do you think regular use of mouthwashes can harm our dental health? If yes, then to what extent?
Yes, good question, Swayam. I just recently mentioned that you should use mouthwashes only for a period of 2 weeks, because there is a chemical reaction that happens due to the chemical components that is present in a mouthwash, which is, I am just using a technical scientific term, that is the Maillard reaction. So a longer usage of mouthwashes lead to more amount of stains on your tooth, which we don't want. So ideally, you should use mouthwashes for a period of 2 weeks, stop it for a month's time, and then start reusing it. So that is just an adjunct to your manual or a mechanical toothbrushing. It is a form of chemical oral hygiene practice. So it should be always used as an adjunct to your mechanical toothbrushing with the help of toothbrushes, interdental lathes, etc.
Olumi ma'am, we'll take only one more question. I think time is over. Last question.
Okay, ma'am. All right. So last question, Sohana Roy.
Yes, ma'am. Ma'am, I just wanted to ask that since wisdom tooth removal is unique and also its position and shape sometimes may require us to go for surgical removal. So have dentists come up with a better method for removing it without any risks for the patient?
Perfect. So I think you must be having some wisdom tooth issues right now to be able to bring up this question. So I hope not. Yes, we have a lot of newer technologies that has helped us to get those wisdom teeth extractions done in the form of piezoelectric surgery, as I mentioned, lasers and CBCT. Also, various radiographs help us to know the angulation of the tooth and its placement in the oral cavity if it's nearer to any nerve that would be damaged during the process of extraction. So if you're worried for your extraction procedures, no, it is usually painless unless and until there are any complications involved. But yes, if we have ideally done a proper diagnosis of the tooth structure that is present, the extraction goes effortlessly and is mostly painless.
Thank you, ma'am.
All right. Thank you for answering all those questions. Dr. Todi, I would now request Suhani to please do the vote of thanks.
Thank you, ma'am. Today's session was extremely informative and encouraging for all of us. Thank you, Dr. AASTHA Todi, for taking time out of your busy schedule and being with us here today. On behalf of all of us, I extend my profound gratitude to you for sharing your journey and experiences with us. Your versatility and dedication towards work will truly be very inspiring. I would like to extend my gratitude to our mentor, Ma'am Mahota, our principal, Ma'am Shaha, our vice principal, Ma'am Ghosh, and our teachers for organizing this session. I would also like to thank my fellow classmates for being so enthusiastic throughout. Last but not the least, I would like to thank our school's technical team for being the backbone of today's session and for ensuring the smooth flow of today's event. Thank you.
Thank you so much, Suhani. Thank you to all my teachers for giving me this opportunity to reconnect with you all.
Thank you, Astha. It was very informative. We have really learned a lot from your session.
Thank you so much, ma'am.
I think I've shared your email address with Siliguri School also. So if they have a question, any further questions rather, so they can, I think, eventually ask.
Please feel to connect with me through the email. And in case you have any doubts, I would share my number as well on the email. So I would be glad to help.
Thank you. Thank you, Mr. Lokhi. You can end the